Eleanor Wilson froze mid-reach for her bedside lamp, her trembling fingers suspended in the darkness. The searing pain had jolted her from sleep at precisely 3:17 a.m., her neck throbbing with a vicious rhythm that made her stomach clench. What she had dismissed as a simple bug bite for days was now a grotesque, pulsating mass beneath her weathered skin. Martha from next door dropped her mug of chamomile tea when Eleanor knocked frantically at her door, the ceramic shattering across the linoleum like her sense of security. "Sweet Jesus," Martha whispered, her usual composure crumbling as she stared at the angry red swelling. Eleanor had spent 40 years as a nurse, had witnessed the ravages of disease across 3 continents, had held the hands of the dying without flinching. Yet the unmistakable movement beneath her own skin unleashed a primal terror she'd never known. "We need to get you to the hospital right now," Martha commanded, already reaching for her car keys. What was growing inside her? And would they find it before it was too late? Leave a like and share your thoughts in the comments, along with the city you're watching from now. Let's continue with the story. Eleanor Wilson had never imagined her golden years would unfold in the faded beige hallways of Pinecrest Apartments. At 60, her fingers now bore the slight tremor of age, rather than the steady confidence that had once administered vaccinations in remote villages and tended wounds in overcrowded clinics. 40 years as a tropical disease nurse had earned her respect, purpose, and precious little retirement savings. The morning sun filtered through thin curtains, casting long shadows across her modest one-bedroom apartment. Photos of James, her late husband of 35 years, watched from every surface, his kind eyes crinkling at the corners beneath his military cap. A Vietnam veteran with a Purple Heart and lungs scarred by Agent Orange, he had fought his final battle 5 years ago, leaving Eleanor with memories, mounting medical bills, and a pension that shrank with every congressional budget negotiation. "You taking your pills today, Ellie?" Martha Cunningham called through the thin walls most mornings. At 72, Martha had taught 3rd grade for 4 decades, before arthritis twisted her fingers too severely to grade papers. Now she kept watch over the senior residents of Pinecrest with the same attentive care she once showed her students. Eleanor's daily routine had the precision of someone who understood the fragility of health. Blood pressure medication with breakfast, water pills at lunch, pain relievers as needed, but never more than prescribed. She stretched her pension check like an elastic band ready to snap, choosing between prescription refills and fresh produce most months. William Cooper owned both the chemical processing plant at the edge of town and the Pinecrest Apartments where Eleanor and 24 other seniors lived. His occasional visits to the property were marked by expensive cologne and empty promises of repairs. "Just like my own grandmother," he'd say with practiced sincerity while patting Eleanor's shoulder. "We take care of our seniors at Pinecrest." Meanwhile, the elevator broke down bi-weekly, and the water ran rust-colored every 3rd Tuesday. Eleanor's garden plot behind the building was her salvation, 10 square feet of soil where she coaxed tomatoes and peppers to life, the earth beneath her fingernails connecting her to something living and growing when so much around her spoke of decline. The small creek that ran behind the property provided free irrigation, though she'd noticed an odd chemical smell in recent months. Dr. Rebecca Morgan's name still appeared occasionally in medical journals Eleanor read at the library. They had trained together at Johns Hopkins before diverging paths. Eleanor to humanitarian work in Brazil and Rebecca to prestigious research positions. Their friendship had fractured 30 years ago over an ethical disagreement neither had found the courage to mend. Now, Rebecca headed the infectious disease unit at County General, her career ascendant while Eleanor's had concluded with a retirement party in the hospital cafeteria and a watch that stopped working 3 months later. "Age isn't for sissies," Eleanor often quoted to James's photograph as she eased out of bed each morning. joints protesting the day's first movements, but beneath her pragmatic exterior burned the fierce independence that had carried her through jungle clinics and refugee camps. She would manage on her own. She always had. It began on a Tuesday in late July, when the humidity pressed against Pinecrest Apartments like a damp blanket. Eleanor had spent the morning tending her garden plot, coaxing stubborn tomatoes to life despite the heat. The creek that ran behind the property offered some relief, its waters cool against her skin as she dipped her hands to wash away soil. She noticed a slick rainbow sheen on the surface, but thought little of it. Water quality had never been Pinecrest's strong suit. That evening, as she tilted her head to apply moisturizer, Eleanor noticed a small red bump just below her hairline. "Mosquito," she muttered, applying a dab of calamine lotion before preparing for bed. By morning, the spot itched with surprising intensity. "Looks angry," Martha commented over their Wednesday morning coffee. The ritual had begun shortly after James passed, Martha appearing at Eleanor's door with 2 mugs and day-old pastries from her grandson's bakery. "You should put some ice on that." "I've had worse in Brazil," Eleanor dismissed, though she found herself scratching the spot throughout the day. As a nurse, she'd seen every manner of insect bite and infection. This was nothing to concern herself with, certainly nothing worth the $50 copay at the walk-in clinic, not when her Medicare supplement insurance would lapse in 3 days due to a paperwork issue she was still sorting out. By Thursday afternoon, the itching had transformed into a steady throb, the bump now the size of a pencil eraser, red and hot to the touch. Eleanor found herself distracted during her weekly call with the insurance representative. "Mrs. Wilson, I understand your frustration, but until we receive the verification of income form," the young voice droned. "I've sent it twice," Eleanor interrupted, fingers unconsciously probing the increasingly tender spot on her neck. "Once by certified mail and once by fax from the library. Our system shows no record." "Your system," Eleanor snapped with uncharacteristic sharpness, "has been showing no record for 6 weeks while my coverage gap gets closer. My husband served this country for 20 years. He was promised health care for life." "That's veterans benefits, ma'am. Your supplemental coverage is a separate—" "I know what's what, young man. I worked in health care longer than you've been alive." The throbbing in her neck seemed to pulse in time with her irritation. After hanging up, Eleanor examined the site in her bathroom mirror. The swelling had expanded, the center now darker. "Just an infected bite," she told her reflection firmly. She dabbed on antibiotic ointment from her well-stocked medicine cabinet, a nurse's habit, and took 2 ibuprofen with a glass of tap water. That night, memories of Brazil invaded her dreams for the first time in decades. The field hospital outside Manaus. The endless line of patients with tropical diseases she'd only read about in textbooks. The child with the mysterious swelling who died despite their best efforts. Eleanor woke in a sweat, her hand immediately finding the hot, tender mass on her neck. Friday morning, Martha took one look at Eleanor over coffee and set down her mug with unusual force. "This isn't right, Ellie. That's not just a mosquito bite." "It's infected," Eleanor conceded. "I'm treating it." "With what?" "That drugstore ointment. You need antibiotics." "I know what I need," Eleanor said quietly, "and I know what things cost." Martha's expression softened. "Is it the insurance again? My son could—" "I don't need charity." Eleanor cut her off, immediately regretting her tone. "I'm sorry, Martha. It's just, I'll be fine. If it's not better by Monday, I'll go to the clinic." But by Friday evening, Eleanor could no longer deny the seriousness of her condition. The swelling had doubled in size, the pain radiating down her neck and into her shoulder. Worse was the sensation, a periodic pulsing that felt distinctly abnormal. When she pressed gently around the inflamed area, she could have sworn she felt movement beneath the skin. The memory surfaced unbidden, A lecture hall at Johns Hopkins, slides projecting images of parasitic infections. Professor Harmon's voice. Myiasis occurs when fly larvae develop within the skin, usually presenting as a boil-like lesion with a central pore. Eleanor had seen cases during her time in Brazil, the flies laying eggs in open wounds or even unbroken skin. "Don't be ridiculous," she told herself aloud, her voice echoing in the empty apartment. That was 30 years ago and 4,000 miles away. Yet the rational explanations did little to quiet her growing unease. She took her temperature, 100.2, low-grade fever, another sign of infection. The responsible medical professional in her battled with the proud, independent widow living on a fixed income. At 9:17 that evening, a knock at her door startled Eleanor from her worried calculations. William Cooper stood in the hallway, his expensive aftershave preceding him. "Mrs. Wilson," he smiled, all perfect teeth and practiced charm. "Just checking in on our residents before the weekend. Everything satisfactory with your unit?" Eleanor instinctively angled her body to hide the swelling on her neck. "Fine, thank you." Cooper's eyes narrowed slightly. "Are you feeling all right? You look a bit flushed." "Just the heat," Eleanor replied. "The air conditioning. Needs servicing, yes," Cooper finished smoothly. "I've got the repairman scheduled for Monday. Speaking of maintenance, there's been some talk about water quality from a few residents. You haven't noticed anything concerning, have you?" Eleanor thought of the rainbow sheen on the creek, the slight chemical odor. Nothing unusual," she lied, unsure why she felt compelled to do so. "Excellent. The EPA does regular testing, of course. All perfectly safe." He handed her a glossy business card. "But if you do notice anything or need anything at all, my personal number is on there. I take care of my people at Pinecrest." After he left, Eleanor leaned against the closed door, suddenly exhausted. The interaction had drained her more than it should have. The throbbing in her neck seemed to intensify, and when she touched the area, the skin felt stretched and taut, as though something inside was growing. By Saturday morning, Eleanor could no longer deny the severity of her situation. The fever had climbed to 101.4, and the swelling now protruded visibly, the skin angry and red. Martha gasped when Eleanor finally showed her. "Sweet Jesus, Ellie, we're going to the emergency room, now." "The cost—" "Damn the cost!" Martha rarely swore. "You were a nurse. You know this isn't right." Eleanor felt tears threatening, not from pain but from the crushing weight of vulnerability. For decades she had been the caregiver, the competent one, the woman who navigated medical crises with calm efficiency. Now she stood in her faded robe, sick and afraid, needing help she couldn't afford. "Let me call the VA hospital first," she compromised. "James's benefits might—" The phone rang before she could finish. Eleanor answered it with shaking hands. "Mrs. Wilson, this is Dr. Rebecca Morgan from County General." The voice from the past was instantly recognizable despite the decades. Eleanor sat heavily on her sofa. "Rebecca? How did you—" "Martha Cunningham called my office yesterday. She's worried about you." "Something about an infected insect bite?" The mention of Martha's intervention should have angered her, but Eleanor felt only relief. "It's gotten worse. I'd like to see you." "Today?" "Rebecca, I can't afford—" "This isn't about money, Eleanor. Martha mentioned Creek Valley. You were there, weren't you? In '93? The question sent a chill through Eleanor that had nothing to do with her fever. Creek Valley, the outbreak, the patients with the mysterious parasitic infections near the mining operations. "That was 30 years ago," Eleanor whispered. "Yes," Rebecca replied, her voice tight with an emotion Eleanor couldn't identify. "And I think we need to talk about it. I'm sending a car for you. Please, Eleanor, trust me on this." As she hung up the phone, Eleanor felt the mass on her neck pulse once, twice, 3 times. as though whatever lay beneath her skin had heard the conversation and was responding. The sensation was so distinct, so alien, that a sound escaped her throat, not quite a scream, but close. Martha was at her door seconds later, alerted by the noise. She took one look at Eleanor's face and reached for her purse. "We're not waiting for anyone to send a car. My Buick still runs and County General is 20 minutes away." In the car, Eleanor's thoughts drifted between past and present. The young, idealistic nurse she had been in Brazil, working alongside Rebecca before their falling out. The competent professional who had spent decades caring for others. And now, the aging widow with something inexplicable growing inside her. The irony wasn't lost on her. After a lifetime of treating the most exotic diseases, she would become a medical mystery herself. "It's moving," she said quietly as Martha navigated the Saturday morning traffic. "Whatever it is, I can feel it moving." Martha's knuckles whitened on the steering wheel, but her voice remained steady. "Then we'll make it stop moving. You've helped enough people in your time, Ellie. Let someone help you now." As the hospital came into view, a sprawling, modern complex that had replaced the humble county facility where Eleanor had once worked, she felt a strange combination of dread and resignation. Whatever was growing beneath her skin, whatever connection it had to her past, she would finally have to confront it. And Rebecca Morgan, the brilliant colleague who had once been her closest friend before ambition and ethics drove them apart, would be waiting. County General Hospital had the antiseptic gleam of modern medicine, all glass and steel where the old building had been brick and peeling paint. Eleanor leaned heavily on Martha as they approached the reception desk, the swelling on her neck now visibly pulsating beneath her skin. "I'm here to see Dr. Morgan," Eleanor managed, her voice strained. "She's expecting me." The young receptionist glanced up, her eyes widening slightly at the sight of Eleanor's neck. "Your name, ma'am?" "Eleanor Wilson." "One moment." She made a quick phone call, speaking in hushed tones before hanging up. "Someone will be right down to escort you." Martha settled Eleanor into a chair in the waiting area. The Saturday morning crowd was sparse. A young mother with a feverish toddler, an elderly man with an oxygen tank, a teenager with a wrist wrapped in a makeshift bandage. Eleanor felt their curious glances and angled her body away, a lifetime of professional dignity making her resistant to becoming a spectacle. "Mrs. Wilson." A crisp voice cut through Eleanor's discomfort. She looked up to see a woman in a white coat approaching, tall, silver-streaked dark hair pulled back in a neat bun, the same piercing blue eyes Eleanor remembered from decades earlier. "Rebecca," Eleanor acknowledged, struggling to rise. "Stay seated," Dr. Morgan instructed, kneeling to examine Eleanor's neck without preamble. Her gloved fingers probed the inflamed area with clinical precision. "How long?" "Started Tuesday. Small bump. By Thursday it was clearly infected. Now," Eleanor gestured helplessly. "And the movement?" Eleanor swallowed hard. "Since last night. Distinct pulsations." Dr. Morgan's expression remained neutral, but Eleanor caught the slight tightening around her eyes, the look she remembered from their days treating unusual cases. "We need to get you into an exam room immediately. Are you her friend?" she directed toward Martha. "Martha Cunningham. We're neighbors." "Thank you for bringing her in, Miss Cunningham. You can wait here or come back." "I'm staying," Martha interrupted firmly. "Ellie doesn't have anyone else." A flash of something, guilt, regret, crossed Dr. Morgan's face before she nodded briskly. "Very well, this way." The examination room was state-of-the-art, a far cry from the makeshift clinics where Eleanor had spent much of her career. As a nurse, she recognized the efficiency of the setup. As a patient, she found it coldly intimidating. "I need to take a full history," Dr. Morgan said, helping Eleanor onto the examination table. "But first, Let's get some preliminary treatment started. The inflammation is significant. A nurse entered, and Dr. Morgan issued rapid instructions for blood work, antibiotics, and imaging. Eleanor submitted to the flurry of activity with growing unease. There was something in Rebecca's manner, a controlled urgency that heightened her anxiety. "You mentioned Creek Valley on the phone," Eleanor said when they were briefly alone. "Why?" Rebecca paused in her note-taking. "There have been 3 cases in the past month. Similar presentations, all initially appearing as infected insect bites, all progressing to advanced myiasis with unusual characteristics." "Myiasis?" Martha echoed. "What's that?" "Parasitic infestation," Eleanor explained automatically. "Fly larvae developing under the skin." Martha blanched. "You mean there are bugs?" "It's a working diagnosis," Rebecca interrupted. "We won't know for certain until we conduct more tests." "And the connection to Creek Valley?" Eleanor pressed. Rebecca met her eyes directly for the first time. All 3 patients had some connection to humanitarian work in South America during the early 90s. "Just like you." The implications hung in the air between them. Creek Valley had been the site of a mysterious outbreak 30 years ago. A remote mining community in Brazil where Eleanor, Rebecca, and a team of international health workers had battled an unusual parasitic infection. The case had never been fully resolved. The scientific papers Rebecca published afterward hotly contested. "That's impossible," Eleanor whispered. "After all this time?" "Some parasites can remain dormant for decades," Rebecca replied, "triggered by the right conditions." The door opened before Eleanor could respond, an orderly arriving to transport her to radiology. As they wheeled her from the room, Eleanor caught sight of her reflection in a glass cabinet, her face pale, the grotesque swelling on her neck now visibly moving beneath the skin. She closed her eyes against the image. The MRI was claustrophobic, the machine's rhythmic thumping a counterpoint to the pulsations in her neck. Eleanor focused on breathing steadily, on not succumbing to the panic that threatened to overwhelm her professional detachment. By the time they returned her to the examination room, the antibiotics were beginning to work on her fever, but the sensation of movement had intensified. "The imaging shows a significant subcutaneous mass," Rebecca explained, displaying the scans on a monitor. "Approximately 3 centimeters in diameter with distinct internal structures consistent with larval development." Eleanor stared at the grainy images of her own neck, at the unmistakable outlines of something living beneath her skin. Despite her medical knowledge, or perhaps because of it, she felt a wave of primal revulsion. "You need to remove it," she said flatly. "We will," Rebecca assured her. "I've scheduled you for a procedure this afternoon. But Eleanor, there's something else you should know." The door opened again, and a man in an expensive suit entered. William Cooper's presence was so unexpected that Eleanor momentarily thought she was hallucinating. "Mrs. Wilson," he said, his practiced smile firmly in place. "Dr. Morgan called me. I came as soon as I heard." Eleanor looked between them in confusion. "You two know each other?" "Mr. Cooper has been generous to our research department," Rebecca explained smoothly. "When I learned you were a resident at Pinecrest, I thought he should be informed." Something in Rebecca's tone set off warning bells in Eleanor's mind, the same instinct that had served her well in field hospitals and disaster zones. There was an undercurrent here she couldn't quite grasp. "That's very thoughtful," Eleanor said carefully. "But I don't see why my landlord needs to be involved in my medical care." Cooper stepped closer, his cologne overwhelming in the small room. "I consider all Pinecrest residents part of my extended family, Mrs. Wilson. When Dr. Morgan mentioned your condition might be related to environmental factors, I was naturally concerned." "Environmental factors?" Eleanor echoed, looking to Rebecca. "The parasites in the other cases showed unusual adaptations," Rebecca said, possibly related to chemical exposure. I understand there's a creek behind Pinecrest where you garden? The pieces began to align in Eleanor's mind, the rainbow sheen on the water, the chemical smell, Cooper's earlier questions about water quality. Your plant, she said to Cooper. It's upstream from Pinecrest. Cooper's smile never wavered. Cooper Chemical adheres to all EPA regulations, I assure you, but out of an abundance of caution, I've already authorized comprehensive water testing. How thoughtful, Martha interjected, her tone uncharacteristically sharp. And the testing will be conducted by an independent laboratory, of course, Cooper replied smoothly. In the meantime, I've arranged to cover any medical expenses not handled by Mrs. Wilson's insurance. Eleanor blinked in surprise. That's not necessary. I insist, Cooper said, placing a hand on her shoulder. It's the least I can do. As he spoke, a particularly strong movement from the mass in her neck made Eleanor gasp. Cooper withdrew his hand quickly, unable to hide his momentary revulsion. I should let you rest before your procedure, he said. Composure recovered. Dr. Morgan has my number if you need anything at all. After he left, Eleanor turned to Rebecca. What's really going on here? Rebecca busied herself checking the IV line. He's right about the medical expenses. Medicare won't cover experimental treatments, and given the unusual nature of your case, Rebecca, Eleanor's voice took on the authoritative tone she'd used with junior nurses. We worked together for 3 years. I know when you're holding back. Rebecca met her gaze, something like the old camaraderie flickering between them. The parasites in the other cases showed genetic modifications consistent with chemical mutagenesis. If Cooper's plant is dumping untreated waste, he'd be legally liable, Eleanor finished. And you think he's offering to pay my bills to keep me quiet? I think he's protecting his interests, Rebecca replied carefully. Just as he did 30 years ago in Brazil. The revelation hit Eleanor like a physical blow. Cooper Chemicals was the parent company of the mining operation at Creek Valley. Rebecca nodded. Different name, same ownership. I discovered the connection when the first case presented last month. The full implications were still assembling in Eleanor's mind when another healthcare worker entered, a woman in her 40s with a clipboard and a practiced, sympathetic expression. Mrs. Wilson, I'm Victoria Peters from Patient Advocacy. I understand you have limited insurance coverage? The conversation that followed was a humiliating recitation of Eleanor's financial situation, her Medicare coverage, the supplemental insurance she could no longer afford, her limited savings. Throughout, Eleanor felt the creature in her neck moving as though agitated by her rising stress levels. Given Mr. Cooper's offer to cover expenses, Victoria concluded, we can proceed with the surgery today. Otherwise, we'd need to transfer you to county medical for standard treatment options. The subtext was clear. Accept Cooper's money or receive bare minimum care at the overcrowded public hospital. Eleanor's pride warred with her very real fear of what was growing inside her. I'll sign whatever's necessary, she finally said. As Victoria left with the completed paperwork, Martha squeezed Eleanor's hand. You're doing the right thing, Ellie. Take the man's money and worry about the rest later. There's something wrong about all this, Eleanor murmured, her nurse's intuition flaring. Rebecca's research, Cooper's sudden generosity. One problem at a time, Martha counseled. First, we get that thing out of your neck. Then we figure out who's lying about what. The procedure was scheduled for 4 p.m. As the hours ticked by, Eleanor drifted in and out of consciousness, the antibiotics and pain medication creating a hazy buffer between her and the horror of her situation. Rebecca returned periodically to check her status, their conversations brief and professional, the decades of estrangement creating a wall neither seemed able to breach. At 3:30, the pre-surgical team arrived to prepare her. Martha was asked to wait in the visitors' lounge, promising to be there when Eleanor woke up. As they wheeled her toward the operating theater, Eleanor caught sight of William Cooper standing at the nurse's station, deep in conversation with Rebecca. Their body language suggested disagreement. Cooper leaning in, Rebecca's arms folded defensively. The anesthesiologist began explaining the procedure, but Eleanor's attention remained fixed on the pair until they disappeared from view. Whatever game was being played, she was certain of one thing. She was not merely a patient, but a pawn. As the anesthesia began to take effect, Eleanor's last conscious thought was of James. "Watch over me," she whispered to her departed husband. "There's something not right here." Then darkness claimed her. Temporary relief from the creature that had made its home beneath her skin. Eleanor emerged from anesthesia in stages, consciousness returning like tide washing over sand. First came sounds, the steady beep of monitors, hushed voices, the squeak of rubber-soled shoes on linoleum. Then sensation, the pull of an IV in her arm, the pressure of bandages on her neck, the cottony dryness in her mouth. Finally, awareness. She was in recovery, the procedure was over, and whatever had been growing inside her was gone. "She's waking up," a nurse's voice announced. "Dr. Morgan, she's coming around." Eleanor forced her eyes open, blinking against the harsh fluorescent lighting. Rebecca's face swam into focus above her, the professional mask firmly in place, but strain evident in the tight lines around her mouth. "The surgery was successful," Rebecca informed her. "We removed the parasite completely. You're going to be fine, Eleanor." Eleanor tried to speak, found her throat too dry, accepted a small sip of water from the nurse's offered cup. "What was it?" she finally managed to whisper. A slight hesitation. "A human botfly larva, Dermatobia hominis, significantly larger than typical specimens with some unusual characteristics we're still analyzing." Eleanor knew enough about tropical parasitology to understand the implications. Botfly infestations weren't uncommon in parts of South America, but they rarely reached advanced stages in the U.S., where they were typically identified and removed early. And they certainly didn't remain dormant for decades. "Show me," she requested. Rebecca shook her head. "You need to rest. We can discuss the findings tomorrow when—" "Show me," Eleanor repeated, her voice stronger. "I've spent my career dealing with parasitic infections, Rebecca. I deserve to see what was living inside me." Something like respect flickered across Rebecca's features. She signaled to the nurse, who brought over a sealed specimen container. Inside, floating in preservative fluid, was an entity that made Eleanor's stomach clench despite her professional detachment. The larva was grotesquely large, nearly 3 centimeters in length, its segmented body a mottled gray-black. Most disturbing were the rows of fine, hook-like structures that had anchored it beneath her skin, and the dark, bulbous head region that appeared almost eyeless, evolved for a lightless existence. "It's abnormal," Eleanor stated flatly. Rebecca nodded. "The development pattern, size, and certain anatomical features suggest environmental mutation. We've sent samples for genetic analysis and toxicology screening." Eleanor handed back the container, suddenly exhausted. "And the other cases? Were they identical?" "Similar," Rebecca admitted. "But yours was the most developed specimen we've recovered," she hesitated, then added more quietly, "and the only one we believe may have been dormant since Brazil." The implication hung between them, a link to their shared past, to the outbreak they'd fought together before professional ambition and ethical disagreements had driven them apart. "You think I've been carrying this thing for 30 years?" Eleanor asked, the horror of the concept penetrating even her clinical mindset. "It's a working theory," Rebecca replied carefully. "Female botflies typically lay eggs on carrier insects like mosquitoes, which then transfer them to human hosts. In most cases, the larvae develop and emerge within weeks. But there have been documented cases of delayed development under unusual conditions. Eleanor closed her eyes, memories surfacing from Creek Valley, the mining community where copper extraction had contaminated the water supply, where an unusual cluster of parasitic infections had emerged among both workers and the medical team sent to help them, where Eleanor and Rebecca had worked side by side before everything changed. "William Cooper knows about this connection," Eleanor stated, rather than asked. Rebecca's expression tightened. "He's been informed of the preliminary findings." "Is that why he's paying my medical bills? To keep this quiet?" When Rebecca didn't immediately respond, Eleanor pressed harder. "Rebecca, if his company's chemicals created these mutations 30 years ago and they're doing it again now—" "We don't have proof," Rebecca interrupted. "Only theories and preliminary data. Cooper Chemical employs thousands of people in this county." "The economic implications of unfounded accusations—" "Unfounded?" Eleanor's voice rose despite her weakness. "You just pulled a mutated parasite out of my neck that you believe has been dormant for 30 years, coincidentally becoming active after I've been exposed to water potentially contaminated by the same company's chemicals. What more proof do you need?" A soft knock at the door interrupted their increasingly heated exchange. Martha peered in, her face lighting with relief at seeing Eleanor awake. "Thank the Lord," she exclaimed, hurrying to Eleanor's bedside. "How are you feeling, Ellie?" "Like I've had something living inside me for 3 decades, Eleanor replied dryly, her anger at Rebecca temporarily sidelined. Martha blanched slightly but recovered quickly. "Well, it's gone now. That's what matters." She turned to Rebecca. "When can I take her home, doctor?" "We'd like to keep Mrs. Wilson overnight for observation," Rebecca answered. "If all remains stable, discharge would be possible tomorrow afternoon." After Rebecca left, Martha settled into the visitor's chair with the air of someone prepared for a long stay. "I brought your nightgown and toiletries," she said, placing a small overnight bag on the bedside table. "And I watered your tomatoes. They're coming along nicely despite this heat." Eleanor felt a surge of affection for her neighbor's practical kindness. "Thank you, Martha, for everything." Martha waved away the gratitude. "That's what neighbors do." She leaned closer, lowering her voice. "There's something else you should know. While you were in surgery, I got to talking with some of the other folks in the waiting room. Turns out Mrs. Abernathy from the 3rd floor was in last week with something similar. Not as bad as yours, but the same kind of thing. And old Mr. Jenkins from the building next to ours, too." Eleanor's nurse's instinct sharpened through the fog of post-anesthesia. "From Pinecrest? Both of them?" Martha nodded. "And both garden using that creek water, just like you." The coincidence was too significant to ignore. 3 cases of unusual parasitic infections, all from the same apartment complex, all with exposure to the same water source, water that flowed directly past Cooper Chemical's processing plant. "Did you tell Dr. Morgan?" "Tried to," Martha confirmed, "but she was called away for some meeting before I could give her the details. That Mr. Cooper was there, looking none too pleased." Eleanor's suspicions crystallized. Rebecca's reluctance to pursue the connection, Cooper's unusual generosity, the pressure to keep the findings confidential, it all pointed to a cover-up in progress. The remainder of the day passed in a blur of vital sign checks, medication administrations, and fitful rest. Eleanor's neck throbbed where the parasite had been removed, the wound draining into a small surgical tube. Each time she touched the bandage, she imagined the creature that had been living beneath her skin, feeding on her tissues, perhaps waiting for some chemical trigger to accelerate its growth after decades of dormancy. As evening settled over the hospital, Eleanor found herself alone, Martha having reluctantly departed with promises to return in the morning. The quiet of the private room, another courtesy of Cooper's funding, gave her time to think, to connect dots that others seemed determined to keep separate. She reached for her purse, wincing at the movement, and extracted her old address book. The leather was cracked with age, the pages yellowed, but the information she sought was still there. Diane Harlow, environmental lawyer, who had worked with them briefly in Brazil before returning to the States to pursue legal action against companies like the one that had owned the Creek Valley mine. Eleanor hesitated only briefly before reaching for the hospital phone. The call took several transfers and a message left with an answering service, but within 30 minutes, her phone rang. "Eleanor Wilson," a crisp female voice said when she answered. "It's been a long time." "Too long, Diane," Eleanor agreed. "I'm afraid I need your professional advice." She outlined the situation concisely: her infection, the other cases at Pinecrest, the connection to Cooper Chemical, and the potential link to Creek Valley 30 years earlier. Diane listened without interruption, the occasional scratch of a pen the only indication she was taking notes. "This is serious, Eleanor," she said when Eleanor finished. "If what you're suggesting is correct, Cooper Chemical could be facing not just regulatory fines, but criminal charges for environmental contamination and the resulting health impacts." "I need to know my options," Eleanor said. "Rebecca, Dr. Morgan seems reluctant to pursue this angle, and Cooper is paying my medical bills, which I suspect comes with expectations of my silence." "Did you sign anything?" Diane asked sharply. "Just standard hospital forms. Nothing specifically about confidentiality regarding the cause." "Good. That gives us room to maneuver." Diane paused. "I'd like to come see you tomorrow. In the meantime, don't sign anything else, and try to secure a sample of the parasite they removed if possible." "I'm not sure I can." "You're a patient with the right to your own medical information and biological materials," Diane reminded her. "Be polite, but firm." After ending the call, Eleanor felt simultaneously energized and exhausted. The nurse who came to check her vitals commented on her elevated heart rate and blood pressure. "Just processing everything," Eleanor explained, not untruthfully. "Understandable," the nurse sympathized, adjusting Eleanor's IV. "It's not every day you have something like that taken out of you. Dr. Morgan said it was some kind of tropical bug." "Something like that," Eleanor agreed, not wanting to elaborate. "Well, you're not the first this month. We had a similar case last week. Older gentleman, same kind of extraction procedure. Dr. Morgan was very interested in that one, too." Eleanor seized the opening. "Was his name Jenkins by any chance?" The nurse looked surprised. "I can't really discuss other patients, but—" "You know him?" "We're neighbors," Eleanor said, "at Pinecrest Apartments." Something flickered across the nurse's face. Recognition, then concern. "Pinecrest? That's the third case from there." She lowered her voice. "Between you and me, there's been some talk among the staff. 3 cases of tropical parasites from the same apartment complex. It's unusual." "Has anyone looked into it officially?" Eleanor pressed. The nurse glanced toward the door, then leaned closer. "Doctor?" "Morgan collected all the specimens herself, said they were part of a research study, but then that businessman showed up, the one who owns half the county, and suddenly everything got very hush-hush." Eleanor wasn't surprised by the confirmation of her suspicions, but it still sent a chill through her. "Thank you for telling me. Just be careful," the nurse advised, straightening up. "Whatever's going on, there's money involved. And money talks louder than patience, in my experience." After the nurse left, Eleanor lay awake in the darkened room, her mind racing despite her body's exhaustion. The creature was gone from her neck, but the implications of its presence, and the forces aligned to minimize those implications, were growing by the hour. A soft knock at her door startled her from her thoughts. Eleanor tensed, expecting Rebecca, or perhaps even Cooper himself, but the figure that slipped into her room was neither. Mrs. Wilson? The young woman approached tentatively. I'm Catherine Peters. My grandmother lives at Pinecrest. Edith Peters? In 3B? Eleanor recognized the name, a quiet woman who rarely left her apartment but always had a kind word when they passed in the hallway. Yes, I know Edith. Is she all right? Catherine's expression tightened. She's been admitted to county medical. Same symptoms you had, swelling, infection, something moving under the skin, but since she doesn't have insurance that covers county general, the implication was clear. Without Cooper's generosity, Edith had been sent to the underfunded public hospital where care would be adequate but hardly specialized. When was she admitted? Eleanor asked. This morning, after 3 days of being told it was just an infected bug bite. Catherine's voice held barely contained anger. The nurse at County Medical mentioned other cases here with some specialist. I thought maybe... Dr. Morgan, Eleanor supplied. She handled my case. Would she see my grandmother? I can't bear the thought of her suffering while whatever that thing is keeps growing inside her. Eleanor reached for the call button. We're going to find out. The night nurse who responded was not pleased to be asked to contact Dr. Morgan at home, but Eleanor's insistence, backed by her own medical credentials and the specter of an elderly woman with an advancing parasitic infection, eventually prevailed. Rebecca arrived 30 minutes later, looking harried and displeased to find Catherine in Eleanor's room. This is highly irregular, she began, but Eleanor cut her off. Edith Peters, 78 years old, resident of Pinecrest Apartments, currently at County Medical with what appears to be the same condition you treated me for. She needs your expertise, Rebecca. Rebecca's professional mask faltered slightly. Eleanor, I can't just... Can't just what? Treat a patient who doesn't have Cooper's financial backing. Who might become another data point connecting these infections to his company? The accusation hung in the air between them. Catherine looked from one woman to the other, confusion evident on her face. What does Cooper Chemical have to do with my grandmother's condition? Eleanor held Rebecca's gaze. That's what we're trying to determine, isn't it, Dr. Morgan? For a moment, Eleanor glimpsed the young, idealistic doctor she had known in Brazil, the woman who had once been passionate about medical ethics and patient advocacy before career ambitions had led her down a different path. I'll make some calls, Rebecca finally said. See about having Mrs. Peters transferred here for evaluation. Thank you, Catherine said fervently. I don't understand everything that's happening, but I'm grateful for your help. After Rebecca and Catherine left, the former to arrange the transfer, the latter to return to her grandmother's bedside, Eleanor sank back against her pillows, drained but satisfied. 4 cases now, all from Pinecrest, all with access to the creek water. The pattern was becoming impossible to ignore, even for those who might prefer to look away. Her neck throbbed where the parasite had been removed, a constant reminder of what she had carried within her, perhaps for decades. As she drifted toward uneasy sleep, Eleanor wondered what else remained hidden beneath surfaces, waiting for the right conditions to emerge. The operating theater hummed with controlled urgency as Edith Peters was wheeled in, her frail body dwarfed by the expanse of the surgical table. Eleanor, against medical advice but through Rebecca's reluctant permission, observed from behind a glass partition. Her own surgical wound was less than 24 hours old, the drain still in place beneath her bandages, but she had insisted on witnessing this procedure. Professional curiosity, she had claimed. But both women knew it was more, a need to understand what connected them all. Beginning primary incision, Dr. Howard Bennett announced, his voice carrying through the intercom. Unlike Rebecca, Bennett was old school, a surgeon who had trained when medicine was as much art as science, who believed patients were people rather than cases. Eleanor had requested him specifically for Edith's procedure. Rebecca stood beside Eleanor, tension radiating from her rigid posture. "This isn't standard protocol," she murmured, "not for the first time. Having a patient observe surgery. Neither is transferring someone from county medical in the middle of the night," Eleanor countered. Yet here we are. On the table, the surgical team worked with practiced efficiency. The incision on Edith's neck revealed angry, inflamed tissue. Even through the glass, Eleanor could see the unnatural movement beneath the skin. "There it is," Bennett said, his steady hands working with delicate precision. Similar presentation to Mrs. Wilson's case. Eleanor watched, transfixed, as Bennett carefully extracted what appeared to be another botfly larva. This one, perhaps slightly smaller than hers had been, but with the same abnormal coloration and anatomical features. Rebecca's breath caught audibly as the specimen was fully removed and placed in a collection container. "Second organism visible," Bennett announced, his tone sharpening. "Unusual. Preparing for additional extraction." "Two?" Rebecca stepped closer to the glass. There were no indications of multiple parasites on the imaging. Eleanor felt cold dread pool in her stomach as Bennett extracted a second larva, then a third, each slightly smaller than the last. The implications were staggering. Not a single parasite, but a progression, perhaps a breeding cycle that had been interrupted in Eleanor's case but had advanced further in Edith's. "Tissue samples from the cavity wall," Bennett directed his assistant, "and flush with antibiotic solution before closure." The remainder of the procedure was textbook: wound cleaning, drainage tube placement, meticulous suturing. Throughout, Eleanor observed the specimens in their containers, the unnatural creatures that had been living inside her elderly neighbor. By the time Bennett closed, Eleanor had formulated a theory that chilled her to the bone. "They're reproducing," she said to Rebecca as they walked from the observation area. "These aren't just individual infestations. They're colonies." Rebecca's face remained impassive, but Eleanor saw the flicker of acknowledgement in her eyes. "We need more data before making that conclusion." "The data is right in front of you," Eleanor insisted, gesturing toward the specimen containers now being labeled by a surgical nurse. 3 distinct developmental stages. This isn't just dormancy and activation, it's evolution. "Keep your voice down," Rebecca warned, guiding Eleanor to a small consultation room off the surgical wing. Once inside, her professional facade cracked slightly. "Do you think I don't see what you're seeing? Of course it's concerning, but making accusations without conclusive evidence. When will you have enough evidence, Rebecca? After how many patients? How many neighbors of mine need to have parasites cut out of them before you acknowledge what's happening?" Rebecca sank into a chair, suddenly looking every one of her 58 years. "It's complicated, Eleanor. The research funding, the hospital's relationship with Cooper, complicated." Eleanor felt decades of suppressed anger bubbling to the surface. "It was complicated in Brazil, too, wasn't it? When you chose your research paper over reporting what we all knew was happening at that mine?" The old wound lay exposed between them, their final falling out at Creek Valley, when Rebecca had published findings that downplayed the connection between the mining company's practices and the parasitic outbreak among workers. "That's not fair," Rebecca said quietly. "The evidence wasn't conclusive then either. People were dying. And more would have died if the medical station had been shut down. You never saw the bigger picture, Eleanor. Sometimes compromise is necessary for the greater good." Eleanor laughed bitterly. "The greater good? Is that what you tell yourself when you cash Cooper's research grants? When you look the other way while his chemicals create monsters that burrow under people's skin?" Rebecca stood abruptly. "I have a patient in recovery. We'll continue this discussion when you're thinking more clearly." After she left, Eleanor remained in the consultation room, her own pain medication wearing off, her neck throbbing in time with her racing heart. The confrontation had drained what little energy she had, but it had also crystallized her resolve. If Rebecca wouldn't act, she would. Eleanor made her way slowly back to her room, where she found Catherine waiting, her young face lined with worry. "How is she?" Catherine asked immediately. "The surgery was successful," Eleanor assured her. "Dr. Bennett removed the parasites and cleaned the wound thoroughly. Your grandmother will need time to recover, but the prognosis is good." Catherine sagged with relief. "Thank God. And thank you, Mrs. Wilson. If you hadn't intervened—" Eleanor squeezed the younger woman's hand. "There's something else you should know. Your grandmother wasn't the only one. There have been at least 4 cases now, all from Pinecrest, and I believe there's a connection to Cooper Chemical." Catherine's expression sharpened. "The plant upstream from the apartment complex? My grandmother mentioned the water smelling strange lately." "I think chemicals from the plant are contaminating the creek," Eleanor explained. "And those chemicals may be responsible for activating or mutating these parasites." That's criminal," Catherine said, anger replacing concern. "If they're poisoning people, we need proof," Eleanor cautioned. "I've contacted an environmental lawyer, but we'll need water samples, test results on the parasites, documentation of the cases." Catherine straightened, determination evident in her posture. "I work in digital marketing, but my degree is actually in environmental science. I know how to collect water samples properly, chain of custody procedures, everything." Eleanor felt a surge of hope. That would be incredibly helpful, but be careful. Cooper has considerable influence in this town, and if he suspects we're building a case— "I understand." Catherine's expression was grim. "My grandmother worked 40 years as a school secretary. Her pension barely covers her medication. She deserves better than to be treated as collateral damage in some corporate profit scheme." After Catherine left to return to her grandmother's bedside, Eleanor found herself alone with her thoughts. The surgery had confirmed her worst suspicions. These weren't ordinary parasitic infections, but something altered, adapted. The question remained whether these changes were the result of deliberate experimentation or careless environmental contamination. Either way, William Cooper was at the center of it all. As if summoned by her thoughts, a knock at her door preceded Cooper himself, immaculately dressed despite the early hour, his practiced smile firmly in place. "Mrs. Wilson," he greeted her, "I'm delighted to hear the procedure was successful. Dr. Morgan speaks highly of your recovery progress." Eleanor maintained a neutral expression, years of nursing having taught her the value of an unreadable face. "Mr. Cooper, this is an unexpected visit. I like to personally check on Pinecrest residents when they're under the weather." He settled uninvited into the visitor's chair. "Especially in unusual cases like yours." "How thoughtful," Eleanor replied, her tone carefully modulated. "And the other residents with similar conditions? Have you visited them as well?" If Cooper was surprised by her directness, he didn't show it. "I understand Mrs. Peters was transferred here last night. A terrible coincidence. 2 neighbors with such rare conditions." 4 neighbors, actually, Eleanor corrected. "And coincidence seems increasingly unlikely, don't you think?" Cooper's smile remained fixed, but his eyes hardened slightly. "Dr. Morgan mentioned you had concerns about environmental factors. I want to assure you that Cooper Chemical takes community health very seriously. We've already initiated comprehensive water testing around Pinecrest. Conducted by your own personnel, I presume." "By certified environmental specialist," Cooper countered smoothly. "But I understand your skepticism, Mrs. Wilson. Your background in tropical medicine gives you a unique perspective on these matters." The reference to her professional history was clearly intended to unsettle her. Eleanor wondered how much Cooper knew about her connection to Creek Valley, to the controversial paper Rebecca had published that had ultimately protected his company's interests. "I've always found that transparency is the best approach in potential public health situations," Eleanor said, watching him carefully. "Complete disclosure of testing methods, results, independent verification." "Absolutely." Cooper agreed, his affability unwavering. Though we must balance transparency with preventing unnecessary public alarm. These parasitic infections, while concerning, appear limited to a small number of individuals with specific exposure factors, such as living downstream from your chemical plant? Cooper's smile tightened imperceptibly. We operate within all EPA guidelines, Mrs. Wilson. Our discharge permits are a matter of public record. Permits can be falsified, Eleanor said bluntly. Monitoring stations can be manipulated. I saw it in Brazil 30 years ago, and I wouldn't be surprised to see it happening here. The mention of Brazil caused a flicker of genuine emotion to cross Cooper's face. Concern, perhaps, or calculation. Brazil, he repeated carefully. Creek Valley, I presume. Dr. Morgan mentioned you had worked together there? Before your company buried the evidence linking chemical runoff to the parasitic outbreak, Eleanor confirmed. History has a way of repeating itself, Mr. Cooper. Cooper leaned forward, his practiced charm giving way to something colder, more authentic. Mrs. Wilson, let me be direct. You've undergone a traumatic medical experience, one that naturally leads to seeking explanations. But drawing connections to events from decades ago suggesting corporate malfeasance without evidence, these are serious matters with potential legal implications. Are you threatening me, Mr. Cooper? Not at all, he said, the smile returning. I'm simply pointing out that stress and medication can cloud judgment. Dr. Morgan assures me your condition was likely contracted years ago, possibly during your humanitarian work, and only recently became symptomatic. Eleanor understood the strategy: discredit her, isolate her, make her doubt her own conclusions. It was the same playbook that had been used in Creek Valley when workers began falling ill. That's one theory, she acknowledged. Here's another. Your plant is dumping untreated chemicals into the creek that runs behind Pinecrest. Those chemicals are activating or mutating dormant parasites in some residents and creating conditions for new infestations in others. You're covering this up to protect your company from liability, just as you did 30 years ago. Cooper's facade dropped completely, his expression hardening into something closer to his true nature. That's a serious accusation from someone whose medical bills I'm currently paying. Consider it pro bono, Eleanor retorted, or perhaps compensation for decades of environmental negligence. Cooper stood, straightening his already immaculate suit. I came here out of concern for your well-being, Mrs. Wilson. I see that concern is unwarranted and unwelcome. On the contrary, Eleanor replied, holding his gaze, I'm deeply concerned about my well-being and that of my neighbors, which is why I'll be pursuing all available avenues to determine the source of these infections. I wouldn't recommend that course of action, Cooper said, his tone deceptively light. At your age, with your financial situation, legal entanglements could prove burdensome. The threat was thinly veiled but unmistakable. Eleanor thought of her modest savings, her precarious Medicare coverage, the pension checks that barely covered essentials. Some burdens are worth carrying, Mr. Cooper, she said quietly. My husband used to say that the measure of a life well lived isn't comfort but conviction. James would expect nothing less of me than to stand up when I see wrong being done. Cooper's expression was unreadable as he moved toward the door. I hope your recovery continues smoothly, Mrs. Wilson. Do give my regards to Dr. Morgan when you see her. After he left, Eleanor exhaled slowly, her heart racing despite her outward calm. The confrontation had confirmed what she already suspected. Cooper knew exactly what was happening and was actively working to suppress the information. The question now was how deep the cover-up went, and who else was involved. A nurse arrived to check her vitals, frowning at her elevated blood pressure and heart rate. Are you in pain, Mrs. Wilson? I can administer another dose of medication. I'm fine, Eleanor assured her. Just had an upsetting visitor. The nurse made a note in the chart. Dr. Bennett left orders for your discharge this afternoon, assuming your drainage remains minimal and your vitals stabilize. Is there someone who can stay with you for the first 24 hours at home? Eleanor thought of Martha, of the other elderly residents at Pinecrest, all potentially at risk from the same contamination that had affected her. "I'll make arrangements," she said, already formulating a plan. When the nurse left, Eleanor reached for her phone and dialed Diane Harlow's number. "It's Eleanor," she said when the lawyer answered. "Cooper just paid me a visit. We need to move quickly." By noon, the pieces were falling into place. Diane had filed emergency petitions for independent water testing around Pinecrest and preservation orders for all medical specimens related to the parasitic infections. Catherine had collected preliminary water samples from 3 locations along the creek, properly documented with photographs and GPS coordinates. Martha had mobilized a phone tree among Pinecrest residents, identifying 3 more individuals with suspicious symptoms who hadn't yet sought medical attention. As Eleanor prepared for discharge, Rebecca appeared at her door, her expression troubled. "I've just reviewed Mrs. Peters' specimens," she said without preamble. "The genetic sequencing shows significant abnormalities, consistent with chemical mutagenesis, as you suspected." Eleanor waited, sensing there was more. "I've also reviewed the hospital admissions data for the past 6 months," Rebecca continued. "There have been 7 cases presenting with similar symptoms, all within a 5-mile radius of Cooper Chemical, not just Pinecrest residents." "You're finally seeing the pattern," Eleanor observed, neither accusatory nor triumphant. Rebecca met her gaze directly. "I've always seen it, Eleanor. She hesitated. "The research funding, my position here, the potential implications if we're wrong, and if we're right. How many more people will suffer while you weigh the professional consequences?" Rebecca's shoulders sagged slightly. "I've submitted the genetic analysis to the CDC and requested an epidemiological investigation. Cooper won't be able to block that, even with his influence." It was a significant step, one that could potentially break the case wide open. Eleanor felt a glimmer of the old camaraderie between them. 2 medical professionals united in pursuit of truth, as they had been before ambition and compromise had driven them apart. "Thank you," she said simply. Rebecca straightened, professional demeanor reasserting itself. "This doesn't mean I agree with your approach, Eleanor. There are protocols, procedures. People are sick, Rebecca. Our neighbors, your patients. Some things matter more than protocols." Before Rebecca could respond, Dr. Bennett arrived with Eleanor's discharge paperwork. As he reviewed her wound care instructions, Eleanor caught Rebecca watching her with an unreadable expression, something between respect and resignation, as if acknowledging that Eleanor's moral certainty had always been both her greatest strength and her most challenging quality. "You're officially free to go, Mrs. Wilson," Bennett announced. "Though I'd advise against environmental activism for at least a week while that incision heals." Eleanor smiled at his perceptiveness. "No promises, Doctor." As Martha helped her gather her belongings, Eleanor felt the weight of what lay ahead. The battle against Cooper Chemical, the challenge of protecting her neighbors, the uncertainty of her own health. The creature that had lived beneath her skin was gone, but its implications remained, burrowing deeper than any parasite could reach. Eleanor's return to Pinecrest Apartments felt like entering a changed landscape. The familiar beige hallways and worn carpet seemed ominous now, the building itself complicit in the danger threatening its residents. Martha hovered anxiously as Eleanor settled onto her sofa, adjusting pillows and fussing with medications. "You should be in bed," Martha chided, arranging Eleanor's prescription bottles on the coffee table. "Dr. Bennett said limited activity for at least 3 days." "I've spent enough time horizontal," Eleanor replied, though her body ached with exhaustion. The surgical wound on her neck throbbed beneath its bandage, a constant reminder of what had been removed, and what might still be lurking in the environment around them. Through her window, Eleanor could see the creek winding behind the property, sunlight glinting off its surface in deceptive beauty. How many times had she dipped her hands in that water, splashed it on her face while gardening? The thought made her stomach clench. "Catherine called while you were getting settled," Martha reported, settling into the armchair across from Eleanor. "She's dropping off the water samples at the independent lab Diane recommended. Results should be back in 48 hours. 48 hours, Eleanor echoed, her nursing experience telling her that was simultaneously remarkably quick and agonizingly slow. Every hour meant potential new exposures, new infections developing beneath unsuspecting skin. A knock at the door interrupted her thoughts. Martha peered through the peephole before opening it to reveal Victoria Peters, the hospital social worker, clutching a folder and wearing an expression of professional concern. "Mrs. Wilson," she greeted, stepping inside. "I hope I'm not intruding. The hospital asked me to follow up on your discharge planning." Eleanor recognized the pretense for what it was, Cooper's influence reaching into her home through official channels. "That's very thorough of them," she replied neutrally. "As you can see, I have support." Victoria glanced at Martha, then back to Eleanor. "Yes, that's good. However, there are some concerns about your living situation given the nature of your infection." "Concerns from whom?" Eleanor asked directly. Victoria hesitated. "The hospital administration feels that your recovery might be compromised by returning to the same environment where you potentially contracted the parasite." "How thoughtful," Eleanor said dryly. "And their recommendation?" "Temporary relocation to a rehabilitation facility," Victoria replied, opening her folder. "Cooper Foundation actually sponsors several excellent options that would be fully covered. The manipulation was so transparent it would have been laughable if it weren't so insidious. Remove her from Pinecrest, isolate her from her neighbors, control the narrative." "That won't be necessary," Eleanor stated firmly. "I'm perfectly capable of recovering at home with support from my community." Victoria frowned slightly. "Mrs. Wilson, given your age and the seriousness of your condition—" "My age," Eleanor interrupted, a lifetime of dealing with patronizing attitudes surfacing in her tone. "I spent 40 years as a nurse in conditions far more challenging than a post-surgical recovery. I've treated tropical diseases in field hospitals with limited supplies and no air conditioning. I believe I can manage to take antibiotics and change a bandage in my own apartment." Martha suppressed a smile as Victoria shifted uncomfortably. "Of course, it's ultimately your decision, but the offer remains open if you reconsider." After Victoria left, Eleanor let out a long breath. "They're trying to separate us," she told Martha. "Divide and isolate before we can organize." "Too late for that," Martha replied with unexpected steel in her voice. "While you were in surgery, I spoke with every resident in the building. We're having a community meeting tonight in the common room. Everyone's coming, even old Mr. Simmons from the 4th floor, who hasn't left his apartment since his wife died." Eleanor felt a surge of gratitude for her friend's initiative. "Martha Cunningham, community organizer. James would have loved to see this." Martha's expression softened. "He was always proud of your fighting spirit, Ellie. Said you were the toughest woman he'd ever met, including his drill sergeant." The mention of James brought both comfort and a fresh wave of loss. In moments of crisis, Eleanor still instinctively turned to share her thoughts with him, only to encounter the empty space where he should have been. The community meeting was scheduled for 7 p.m., giving Eleanor a few hours to rest. Despite her protestations of capability, her body demanded recovery time. She dozed fitfully on the sofa, dreams invaded by writhing, segmented creatures burrowing beneath her skin. She awoke disoriented, heart racing, hand automatically reaching for her neck. The bandage was secure, the wound beneath it still and quiet. No movement, no pulsation. The relief was so intense it brought tears to her eyes. Martha returned at 6:30, accompanied by Catherine Peters. The younger woman carried a laptop and a determined expression. "How's your grandmother?" Eleanor asked as Catherine set up her computer on the kitchen table. "Stable," Catherine reported. "They're keeping her for another day, but Dr. Bennett is pleased with her progress." She hesitated, then added more quietly, "They found 3 more larvae during a follow-up examination. Smaller ones, deeper in the tissue." Eleanor absorbed this information with professional detachment, though the implications were disturbing. The parasites weren't just growing, but potentially reproducing within the host. If her own infection had been caught earlier than Edith's, it was possible she had narrowly avoided a similar progression. "I've prepared a presentation for tonight," Catherine continued, turning her laptop to show Eleanor a series of slides. "Simple, factual information about what we know so far, the suspected connection to the creek water, and precautionary measures residents should take." Eleanor reviewed the presentation with approval. It was clear, informative, and carefully phrased to present facts without veering into speculation that could be dismissed as alarmist. "This is excellent, Catherine. You found your grandmother's practical approach to communication." Catherine smiled slightly. "Grandma always says, facts first, feelings second. She would have made a good scientist." By 7 p.m., the Pinecrest Common Room was filled beyond capacity. Eleanor was startled by the turnout. Not just the elderly residents she knew well, but younger family members, home health aides, and even a few faces she recognized from neighboring buildings. Martha had clearly cast a wide net. Making her way to the front of the room was an exercise in fortitude. Eleanor felt the strain of her recent surgery with each step, but she maintained the dignified bearing that had served her through decades of nursing and challenging conditions. James had always teased her about her head nurse posture, straight-backed and resolute, the stance of someone who would not be deterred. "Thank you all for coming," she began once the room quieted. "I know many of you have heard rumors about recent medical issues affecting some Pinecrest residents, including myself. We're here tonight to share what we know, what we suspect, and what steps we can take to protect ourselves and our community." Eleanor outlined her own experience clinically, without drama or embellishment. The initial bump, the progression of symptoms, the surgery that had removed a parasitic larva from her neck. She explained that similar cases had been identified among other residents, all with one common factor: exposure to water from the creek that ran behind the property. "We suspect this water has been contaminated by chemical discharge from the Cooper chemical plant upstream," she explained. "Independent testing is currently underway to confirm this hypothesis." A murmur ran through the crowd. Cooper Chemical was the largest employer in the county, its owner one of its most prominent citizens. Questioning its practices was tantamount to civic heresy. "That's a serious accusation," said Mr. Simmons, the reclusive widower from the 4th floor. "Cooper's been good to this town, built the library, sponsors the summer festival, and owns this apartment complex," Eleanor acknowledged, "which is why we must be especially diligent in pursuing the truth, regardless of where it leads." Catherine took over then, presenting the data they had compiled. The cases identified so far, their proximity to the creek, the timeline of symptoms, and the preliminary observations from the medical examinations. Her scientific background lent credibility to the presentation, her slides showing maps of the area with the chemical plant clearly marked upstream from Pinecrest. "Until we have conclusive test results," Catherine concluded, "we recommend avoiding all contact with the creek water. Don't use it for gardening, don't allow pets near it, and report any unusual symptoms immediately to this contact group we're forming." The discussion that followed was measured but emotional. Residents shared stories of recent skin irritations, unusual odors from the water, wildlife disappearing from the creek banks. A pattern emerged of small concerns that, individually, might be dismissed but collectively painted a disturbing picture. "What about legal action?" asked a middle-aged woman Eleanor didn't recognize. "My mother lives here. If this company is poisoning her, we're working with an environmental attorney," Eleanor assured her. "But we need evidence before making formal accusations. The water testing results will be crucial." As the meeting continued, Eleanor noticed a figure standing at the back of the room, Rebecca Morgan, still in her hospital coat, observing silently. Their eyes met briefly across the crowded space, an unspoken acknowledgement passing between them. By the time the meeting concluded, a clear action plan had been established. A monitoring committee would document any new symptoms among residents. Diane Harlow would prepare legal groundwork based on the forthcoming water test results. Catherine would coordinate communication between all parties. As the crowd dispersed, Rebecca approached Eleanor, her expression troubled. "You've been busy," she observed, gesturing to the now emptying room. "People have a right to know what's happening to them," Eleanor replied, "especially when it affects their health." Rebecca sighed, lowering her voice. "Eleanor, I admire your conviction, but you're potentially setting yourself up against a very powerful adversary. Cooper has connections throughout the county: government, healthcare, law enforcement." "I'm aware of his influence," Eleanor said. "I'm also aware of what happens when corporations are allowed to prioritize profit over people's lives. I saw it in Brazil, Rebecca. I won't stand by and watch it happen here." A flicker of the old guilt crossed Rebecca's face. "Creek Valley was complicated, Eleanor. The research we did there led to a paper that absolved the mining company of responsibility," Eleanor finished, "while workers continued to fall ill long after we left." Rebecca straightened, professional dignity reasserting itself. "I came here to tell you that the CDC has agreed to send a field investigator. They'll be here by the end of the week." The news was significant. Federal involvement would be harder for Cooper to manipulate or dismiss. "Thank you," Eleanor acknowledged. "That will help." "I also came to warn you," Rebecca continued, her voice dropping further. "Cooper was at the hospital this afternoon, meeting with the board of directors. Your name came up repeatedly." "Trying to discredit me?" "Suggesting that your condition has affected your judgment, that your history of tropical medicine work has made you see connections that don't exist." Rebecca hesitated. "He mentioned having your competency evaluated." The threat was clear and frightening in its implications. At 60, Eleanor was vulnerable to the particular discrimination that faced aging women. Too easily dismissed as confused, overly emotional, or cognitively declining. "He won't succeed," Eleanor said with more confidence than she felt. "I have documentation, witnesses, and 40 years of impeccable professional judgment." Rebecca looked unconvinced. "Be careful, Eleanor. This isn't just about the parasites anymore. It's becoming personal." After Rebecca left, Eleanor felt the weight of the confrontation ahead settling heavily on her shoulders. She had faced challenging situations throughout her career: outbreaks in remote locations, limited resources, bureaucratic obstacles, but never with the added vulnerability of age and isolation. Martha found her sitting alone in the common room, lost in thought. "You did good, Ellie," she said, taking the chair beside her. "People are listening." "And Cooper is mobilizing," Eleanor replied, sharing Rebecca's warning. Martha's face hardened with determination. "Let him try. We may be old, but we're not powerless. My Henry always said the most dangerous creature isn't the strongest, but the one with nothing left to lose." Eleanor smiled faintly at her friend's resolve. James would have said the same. He never could abide bullies, especially ones in expensive suits. That night, as Eleanor prepared for bed, she caught sight of her reflection in the bathroom mirror. The bandage on her neck was stark white against her skin, covering the wound where the parasite had been extracted. But it was her eyes that captured her attention. The same determined gaze that had carried her through jungle clinics and refugee camps now focused on one final battle for justice. She touched the bandage gently, remembering the horror of feeling something moving beneath her skin. The parasite was gone, but its legacy remained, not just in the physical wound, but in the questions it had unearthed, the connections it had revealed between past and present. As she settled into bed, Eleanor's phone rang, an unknown number that she almost ignored until some instinct prompted her to answer. "Mrs. Wilson?" The voice was unfamiliar, male, hesitant. "My name is Daniel Cooper. William Cooper is my father." Eleanor's breath caught. "Mr. Cooper's son?" "Yes, we've never met. I left Millfield 15 years ago, but I saw your name in some emails on my father's computer when I was visiting this weekend." He paused. "Emails about parasitic infections and water contamination at Pinecrest." Eleanor's heart raced as she processed the implications. "Why are you calling me Mr. Cooper?" "Because this isn't the first time," Daniel said, his voice tight with suppressed emotion. Creek Valley in Brazil wasn't the first cover-up, and Pinecrest won't be the last unless someone stops him. "You know about Creek Valley?" Eleanor could hardly believe what she was hearing. "I know about all of them. The textile factory in Malaysia, the fertilizer plant in Mexico, the mining operation in Brazil. My father's company has been buying up smaller operations, exploiting them for profit, then abandoning them when the environmental damage becomes too obvious to hide." His voice hardened. "I have documents, Mrs. Wilson, internal memos, falsified environmental reports, evidence of systematic contamination dating back 30 years. Eleanor's mind raced with the potential significance of such evidence. "Why are you telling me this? Why now?" There was a long pause before Daniel answered. "My daughter was diagnosed with a rare form of cancer last year. The doctors believe it's linked to environmental exposure." His voice broke slightly. "She's 7 years old, Mrs. Wilson. And I can't help wondering how many other children, how many families have suffered because I stayed silent about what I knew." The personal tragedy behind his decision resonated deeply with Eleanor. How many times had she seen the human cost of corporate negligence during her career? The children in Brazil with mysterious ailments, the workers with unexplained symptoms, all dismissed as statistical anomalies or blamed on poor hygiene or local conditions. "I want to help," Daniel continued, "but I need to know I can trust you, that this won't just disappear into another settlement with a confidentiality clause." "I can't promise what will happen," Eleanor replied honestly. "But I can promise that I won't stop until the truth is known. Your father offered to pay my medical bills, Mr. Cooper. He thought he could buy my silence. He was wrong." "He usually succeeds," Daniel said bitterly. "Money is a powerful motivator, and most people have their price." "I'm not most people," Eleanor said simply. "And neither, it seems, are you." They arranged to meet the following day at a cafe in the neighboring town, away from William Cooper's sphere of immediate influence. As Eleanor hung up the phone, she felt a complex mixture of hope and trepidation. Daniel Cooper's evidence could be the key to exposing decades of environmental crimes, but it also raised the stakes of their confrontation immeasurably. Sleep eluded Eleanor that night, her mind too full of connections forming between past and present. Creek Valley, where she and Rebecca had witnessed the early signs of an unusual parasitic outbreak among mining workers. The paper Rebecca had published afterward, concluding that poor sanitation and local environmental factors were to blame rather than chemical contamination from the mine. Their friendship fractured beyond repair when Eleanor had refused to endorse findings she believed were influenced by the mining company's pressure. And now, 30 years later, the same pattern unfolding in her own community. The same company, under a different name but the same ownership, the same disregard for human life in pursuit of profit. The irony was not lost on Eleanor, that the parasite which had caused her such physical distress might ultimately be the catalyst for exposing decades of corruption and environmental crime, that her own body had become both victim and evidence. When morning finally came, Eleanor rose, feeling every one of her 60 years. The surgical wound throbbed, her joints ached with the familiar stiffness of age, and the weight of responsibility pressed heavily upon her. Yet beneath the physical discomfort burned the same determination that had carried her through decades of challenging conditions. "One more battle," she told James's photograph as she dressed carefully, mindful of her bandages. "One last stand for what's right." The Bluebird Cafe sat just outside Millfield's town limits, a deliberately unremarkable establishment that attracted little attention from locals. Eleanor arrived 15 minutes early, selecting a corner booth with a clear view of both the entrance and the parking lot. Decades of working in volatile regions had taught her to always secure her surroundings, a habit that had never fully faded. Daniel Cooper entered at precisely 10 a.m., his resemblance to his father immediately apparent in his height and bearing, though his face lacked William Cooper's practiced charm. Instead, he carried himself with the slightly hunched posture of someone accustomed to apologizing for his existence. "Mrs. Wilson?" he approached hesitantly. Eleanor nodded, gesturing to the seat across from her. "Thank you for coming, Mr. Cooper. Daniel, please." He slid into the booth, setting a weathered leather briefcase beside him. "I half expected you wouldn't be here." "My father has ways of intervening when people become inconvenient." "I'm aware," Eleanor replied, "though I suspect his usual tactics work better on younger, less stubborn individuals." A ghost of a smile crossed Daniel's face. "You remind me of my grandmother. She was the only person who ever stood up to him consistently." The waitress arrived, pouring coffee for both of them before retreating with practiced discretion. Only when she was well out of earshot did Daniel unsnap his briefcase. "I've been collecting these for years," he explained, extracting a USB drive and several manila folders. "Initially, for my own peace of mind, to confirm I wasn't imagining what I was seeing in the company reports. Later, as insurance, I never thought I'd actually use them." Eleanor accepted the documents, opening the top folder to find internal memos detailing water quality testing at various Cooper chemical facilities. The technical language was dense, but her medical background allowed her to recognize the significance of the highlighted compounds: heavy metals, industrial solvents, compounds known to cause cellular mutations. "These reports show contamination levels well above regulatory limits," she noted. Daniel nodded grimly. "And these show the altered versions submitted to the EPA." He slid another folder across the table. "Notice the differences in the numbers, always just below the threshold for mandatory remediation." Eleanor compared the documents, the systematic falsification unmistakable. "How long has this been going on?" "At least 30 years, across multiple facilities." Cooper Chemical operates on a simple business model: buy struggling plants in economically depressed areas, cut corners on environmental compliance to maximize profit, then sell or abandon the operation when regulatory pressure becomes too intense. Daniel's voice was flat, rehearsed, as if he had explained this many times in his own mind. The local communities rarely have the resources to fight back effectively. "Until now," Eleanor said quietly. Daniel looked at her skeptically. "With all due respect, Mrs. Wilson, what makes Millfield different? You're a retired nurse in your 60s. My father has judges, politicians, and hospital boards in his pocket." "I may be a retired nurse in my 60s," Eleanor acknowledged, "but I'm not fighting alone." She outlined the coalition forming around the Pinecrest cases: Diane Harlow's legal expertise, Catherine's environmental science background, the CDC investigation Rebecca had initiated, and the community organizing Martha had sparked. As she spoke, Eleanor watched Daniel's expression shift from skepticism to cautious hope. You've accomplished more in days than most have managed in years, he admitted. Necessity is a powerful motivator, Eleanor replied. When people are pulling parasites out of their neighbors' necks, it tends to galvanize action. Daniel winced at the blunt description. About the parasites, I found something specific to Creek Valley you should see. He extracted another folder, this one older and more worn than the others. These are from 1993, related to the outbreak you witnessed firsthand. Eleanor's pulse quickened as she opened the folder. Inside were laboratory reports she had never seen during her time in Brazil. Detailed analyses of parasitic specimens collected from infected workers. The company conducted its own research, Daniel explained. Separate from the official medical investigation you were part of. Eleanor scanned the documents, her medical training allowing her to interpret the technical findings. The reports confirmed what she had suspected but could never prove, that chemical runoff from the mining operation had created conditions for parasitic mutation, allowing larvae to develop abnormal growth patterns and survival mechanisms. They knew, she whispered, the decades-old betrayal fresh again. They knew exactly what was happening to those workers. They always know, Daniel said simply. It's never ignorance, Mrs. Wilson. It's calculated risk assessment. The cost of settlements versus the cost of proper environmental controls. Eleanor thought of Rebecca's paper, its careful framing of the outbreak as unrelated to mining operations. Had she known about these studies? Had she deliberately overlooked evidence that didn't support Cooper's preferred conclusions? There's more, Daniel continued, lowering his voice further. Regarding your current situation at Pinecrest. He extracted a final document, an email exchange dated just 2 weeks earlier between William Cooper and the operations manager at the Millfield plant. The subject line read simply, Creek Water Testing Results. Confidential. Eleanor read the exchange with growing horror. The tests had detected elevated levels of multiple industrial compounds in the creek downstream from the plant, directly behind Pinecrest Apartments. More damning was Cooper's response. Implement night-only discharge protocol immediately. Arrange for contaminated soil removal before EPA quarterly inspection. No written reports on this matter. He knows exactly what he's doing, Eleanor said, anger replacing shock. This isn't negligence, it's deliberate. It always is, Daniel confirmed. The Pinecrest property was supposed to be his crowning achievement. Acquire the land cheaply, force out the remaining residents through neglect and rising maintenance issues, then sell to a developer for a luxury housing project. The creek contamination was just a convenient acceleration of the timeline. Until people started developing parasitic infections that could be traced directly to his chemicals, Eleanor concluded. That wasn't part of the plan. Daniel nodded. Hence the damage control, paying your medical bills, pressuring Dr. Morgan, trying to discredit you as confused or paranoid. And now? Eleanor asked. Now that we have evidence? Daniel's expression turned grim. Now it gets dangerous. My father doesn't lose, Mrs. Wilson. Not when the stakes are this high. As if summoned by his words, Eleanor's phone rang, Martha's number flashing on the screen. She answered with a sense of foreboding that proved immediately justified. Ellie, Martha's voice was tight with controlled panic. There are people at Pinecrest, men in hazmat suits. They're saying there's been a gas leak and the building needs to be evacuated immediately. Eleanor's eyes met Daniel's across the table. There's no gas line to Pinecrest, she said, loud enough for him to hear. It's all electric. Daniel's face drained of color. It's starting, he murmured. Martha, listen carefully, Eleanor instructed. This is not a legitimate evacuation. Cooper is trying to clear the building to prevent us from organizing. Tell everyone to request official identification and documentation of the supposed leak. Call the fire department directly to verify. Already done, Martha replied, her voice steadying. The fire chief says they have no record of a gas leak report. Mr. Simmons is blocking the main entrance with his wheelchair, demanding to see a work order. Despite the seriousness of the situation, Eleanor felt a surge of pride in her neighbor's resilience. Good. I'm on my way back. And Martha, I have the evidence we need. All of it. As she ended the call, Eleanor began gathering the documents with brisk efficiency. Your father is making his move, she told Daniel, trying to scatter the residents before we can consolidate our position. Daniel hesitated, conflict evident on his face. I should go with you. These are my documents. I should be the one to explain them. Are you sure? Eleanor studied him carefully. Once you take this stand publicly, there's no going back. Your relationship with your father ended years ago, Daniel finished firmly. When I realized I couldn't reconcile the man who taught me to fish with the man who poisoned the water. They paid quickly and left, Daniel driving them back to Pinecrest in tense silence. As they approached the apartment complex, the scene that greeted them confirmed Martha's report. 2 unmarked vans parked haphazardly, men in white protective suits attempting to enter the building, and a determined group of elderly residents blocking their path. Martha stood at the center of the resistance, her normally gentle demeanor replaced by fierce protection. Beside her, Mr. Simmons sat immovable in his wheelchair across the main entrance, while several other residents formed a human chain behind him. You'll need to provide proper documentation, Martha was saying as Eleanor and Daniel approached. A work order, emergency authorization from the fire department, and identification showing which utility company you represent. The man who appeared to be in charge, younger than the others with an expensive watch visible beneath his protective sleeve, spotted Eleanor and Daniel walking toward the scene. His eyes widened slightly in recognition. Daniel, he called, removing his hood to reveal a face Eleanor didn't recognize. What are you doing here? Hello, Robert, Daniel replied evenly. I might ask you the same question. Since when does Cooper Development handle gas leaks? The man named Robert glanced nervously at his colleagues, then back to Daniel. Your father asked us to secure the property as a precaution. There have been reports of environmental concerns. You mean the parasitic infections caused by Cooper Chemicals' illegal dumping? Eleanor interrupted, stepping forward. The contamination that your company has documented and deliberately concealed? Robert's professional composure faltered. Ma'am, I don't know what you're talking about. We're here about a gas leak. In an all-electric building? Martha challenged. With no notification to the fire department or utility company? The confrontation was drawing attention now, residents from neighboring buildings gathering to watch, several recording the scene on their phones. Robert clearly recognized the situation spiraling beyond his control. We appear to have been given incorrect information, he conceded, signaling to his team to stand down. We'll need to consult with management before proceeding. Excellent idea, Daniel agreed coldly. Please tell my father that his son says hello. As Robert and his team retreated to their vehicles, a cheer went up from the assembled residents. Eleanor took the opportunity to address the growing crowd. Thank you all for standing your ground, she called. This attempted evacuation was not about your safety, but about silencing our questions regarding the contamination of our water supply. She held up the folder of documents. Thanks to Daniel Cooper, we now have evidence of deliberate environmental violations by Cooper Chemical that directly connect to the health issues several of us have experienced. The revelation of Daniel's identity caused a ripple of surprise through the crowd. He stepped forward, accepting the scrutiny with quiet dignity. My name is Daniel Cooper, he announced. My father owns Cooper Chemical and this apartment complex. For years, I've collected evidence of environmental violations across his operations, hoping someone would have the courage to use it. Mrs. Wilson and her neighbors have shown that courage, and I'm here to support their efforts for justice. The impromptu rally transformed into a strategy session as Eleanor, Daniel, Martha, and Catherine convened in the Pinecrest Common Room. Diane Harlow joined by phone, her legal expertise guiding their approach to the new evidence. "This is exactly what we needed," Diane confirmed after hearing a description of the documents, especially the internal emails about the creek contamination. That demonstrates knowledge and intent, not just negligence. "What about the attempted evacuation today?" Martha asked. "Isn't that additional evidence of Cooper trying to cover his tracks?" "Absolutely," Diane agreed. "I'm filing for an emergency injunction this afternoon to prevent any further interference with Pinecrest residents. And with the CDC team arriving tomorrow, we'll have federal involvement that even Cooper can't easily dismiss." As they finalized their strategy, Eleanor noticed Daniel standing slightly apart, examining a community bulletin board covered with photographs of Pinecrest residents at various gatherings, holiday celebrations, gardening days, birthday parties. His expression as he studied these glimpses of ordinary life was complicated, a mixture of regret and resolve. "Your grandmother," Eleanor said, joining him, "the one who stood up to your father. Would she be proud of what you're doing now?" Daniel touched a photograph of elderly residents planting flowers along the building's entrance. "She lived in a place like this after my grandfather died. Not Pinecrest, but similar, a community of people who'd worked hard all their lives and deserved dignity in their later years." He turned to Eleanor, his decision visibly solidifying. She would have expected nothing less. Their moment of understanding was interrupted by Catherine's urgent call from across the room. "Dr. Morgan is here with William Cooper." Eleanor turned to see Rebecca entering the common room, her hospital coat exchanged for a formal suit that signaled the official nature of her visit. Behind her, William Cooper strode with the confident bearing of someone unaccustomed to opposition. His step faltered momentarily when he spotted Daniel. "What is the meaning of this?" Cooper demanded, recovering quickly. "Robert told me there was some confusion regarding the safety protocol we implemented." "The illegal evacuation you attempted, you mean," Eleanor corrected, "based on a fabricated gas leak." Cooper's gaze hardened as it shifted from his son to Eleanor. "Mrs. Wilson, your continued agitation is becoming a community health concern in itself. Dr. Morgan has expressed professional worries about your cognitive state following your surgery." Rebecca looked distinctly uncomfortable at being invoked this way. "I expressed concern about the stress of your recovery period," she clarified, "not about your cognitive abilities." "Regardless," Cooper continued smoothly, "this gathering is unnecessary. The EPA has conducted thorough testing of the creek and found no concerning contamination levels." "The EPA?" Daniel stepped forward, facing his father directly. "Or Cooper Chemical's environmental compliance team submitting falsified results, as they've done for 30 years across multiple facilities?" The color drained from Cooper's face as he fully registered his son's presence and the folder of documents in his hand. "Daniel," he managed, his voice losing its practiced smoothness, "what are you doing here?" "The right thing," Daniel replied simply. "Finally." Cooper's recovery was impressive, his businessman's instinct for damage control reasserting itself almost immediately. "Whatever documents you think you have are internal drafts, taken out of context. Corporate espionage is a serious offense, son. So is knowingly contaminating a water supply with chemicals that cause parasitic mutations," Eleanor countered. "So is falsifying environmental reports to federal agencies. So is attempting to forcibly evacuate a residential building under false pretenses." The confrontation had drawn the attention of every resident in the common room, the silence thick with anticipation. Cooper glanced around, clearly calculating his options. "These are serious allegations," he finally said, his tone shifting to conciliatory. "If there are legitimate concerns about water quality near Pinecrest, Cooper Chemical will of course cooperate fully with proper authorities." He turned to Rebecca. "As Dr. Morgan can confirm, we've already initiated comprehensive testing through appropriate channels." Rebecca's expression was unreadable as she stepped forward. Actually, Mr. Cooper, I came here today because the preliminary results from the CDC advance team have identified concerning levels of several industrial compounds in water samples from the creek. She turned to address the room at large. Based on these findings, the CDC is officially classifying this as a potential public health emergency and will be establishing a field office here beginning tomorrow. The announcement landed like a thunderclap in the quiet room. Cooper's carefully maintained facade cracked visibly, anger flashing in his eyes before he could suppress it. "This is absurd," he began, but Rebecca continued as if he hadn't spoken. Additionally, genetic analysis of the parasitic specimens removed from Mrs. Wilson, Mrs. Peters, and 3 other patients shows evidence of mutagenic adaptation consistent with chemical exposure. The CDC is recommending immediate cessation of all discharge from the Cooper Chemical Facility pending further investigation. Eleanor felt a complex surge of emotion. Vindication, certainly, but also a bittersweet reconciliation with her former friend. Rebecca had finally chosen science over expediency, truth over career advancement. "You've exceeded your authority," Cooper said coldly. "The hospital board will hear about this unprofessional conduct." "The hospital board received the same report I did," Rebecca replied calmly, "as did the EPA, the State Environmental Agency, and the Governor's office. This is no longer a matter of local concern, Mr. Cooper." The significance of Rebecca's words sank in gradually. The machinery of official investigation was now in motion, beyond even William Cooper's considerable influence to halt. Daniel stepped closer to his father, lowering his voice. "It's over, Dad. The pattern stops here." Cooper regarded his son with cold fury. "You have no idea what you've done. The jobs that will be lost, the economic impact on this community." "I know exactly what I've done," Daniel interrupted. "I've chosen people over profit, life over expediency, the values you claimed to believe in when you were teaching me to be a man." Something flickered across Cooper's face then, perhaps recognition, perhaps regret. But it hardened almost instantly into the calculating expression of a businessman assessing damage. "This isn't finished," he said, addressing the room at large but focusing on Eleanor. "A preliminary finding is not a final determination. Cooper Chemical has weathered regulatory challenges before." "Not like this," Eleanor replied steadily. "Not with internal documents proving knowledge and intent. Not with multiple victims and federal involvement." Cooper turned abruptly and left without another word, his usual commanding presence diminished by the knowledge that for perhaps the first time in his career he faced opposition he could neither buy off nor intimidate. In his wake, the common room erupted in conversation, residents processing the confrontation they had just witnessed and its implications for their community. Martha organized an impromptu information session, with Catherine explaining the CDC's involvement and what residents should expect in the coming days. Eleanor found herself momentarily apart from the activity, suddenly exhausted by the emotional and physical toll of the past week. Rebecca approached her, professional demeanor giving way to something more personal. "You were right," she said simply. "About Creek Valley, about Cooper, about all of it." Eleanor studied her former friend's face, seeing the weight of decades of compromise etched into its lines. "What changed your mind?" "The evidence, of course," Rebecca replied. "The genetic analysis of the parasites was undeniable." "And?" Rebecca sighed, abandoning pretense. "And seeing you again, remembering who we were before career ambitions and professional politics got in the way, remembering why we became medical professionals in the first place." The admission was more than Eleanor had expected, a recognition of the moral compromise that had separated them 30 years earlier. "It's not too late to do the right thing," Eleanor said quietly. "It never is." Rebecca nodded, a fragile peace established between them. Not forgiveness exactly, but a recognition of shared purpose restored. The CDC team will want to interview you extensively, Rebecca said, professional mode returning. Your background in tropical medicine and your first-hand experience with both the current cases and Creek Valley makes you uniquely valuable to their investigation. I'll tell them everything I know, Eleanor promised. Every detail I can remember from Brazil, every observation from the current outbreak. As Rebecca left to speak with other residents, Daniel approached Eleanor, his expression troubled. My father won't surrender easily, he warned. He'll fight this with every resource at his disposal. Legal challenges, political pressure, character assassination. I expect nothing less, Eleanor replied. Men like your father don't achieve their position by accepting defeat gracefully. No, Daniel agreed. They don't. He hesitated, then added more quietly, I should warn you about something else. The falsified records, the cover-ups, they're not just environmental. There's financial irregularity, too. If the investigation expands in that direction, there could be significant economic fallout for the community. Eleanor considered this sobering possibility. Millfield depended heavily on Cooper Chemical for employment and tax revenue. A full corporate collapse would devastate families already living on the economic margins. Truth has consequences, she acknowledged, not all of them just or fair. But hiding from it only ensures the poison spreads further, hurts more people. Daniel nodded, recognizing the wisdom in her words. My grandmother used to say something similar. A painful truth heals cleaner than a comfortable lie. Your grandmother sounds like someone I would have liked to know, Eleanor said. You remind me of her, Daniel replied. She never let my father intimidate her either. As the meeting concluded, residents dispersing with a new sense of purpose and vindication, Eleanor found herself drawn back to her garden plot behind the building. The tomato plants she had tenderly cultivated were beginning to bear fruit, their resilience a quiet rebuke to the contamination threatening their environment. She stood at the edge of her garden, gazing at the creek that wound through the property, beautiful still, despite what they now knew about its poisoned waters. The late afternoon sun glinted off its surface, nature's deceptive assurance that all was well. The wound on her neck throbbed faintly, a physical reminder of the creature that had lived beneath her skin and the larger corruption it represented. Eleanor touched the bandage gently, no longer with horror but with a strange sense of purpose. Her body had become evidence, her suffering transformed into testimony that could not be dismissed or denied. In the distance she could see the Cooper Chemical facility, its smokestacks rising against the horizon, a monument to profit prioritized over people, to expedience valued above ethics. Tomorrow, CDC investigators would arrive. Federal environmental officials would inspect the plant. Lawyers would begin the long process of seeking justice for those harmed. But tonight, Eleanor Wilson stood in her garden as the day's last light faded, a 60-year-old widow who had uncovered a 30-year conspiracy and set in motion forces that even William Cooper could not control. The battle wasn't over, might never truly be over, but the truth, so long buried, had finally emerged into the light. Like the parasite beneath her skin, some secrets could only remain hidden for so long before working their way to the surface. 6 months later, Eleanor stood at the edge of what the community now called Restoration Gardens, watching as children from the nearby elementary school planted native wildflowers along the newly restored creek bank. The water ran clear again, the chemical sheen that had once marred its surface replaced by the occasional flash of minnows darting beneath the gentle current. They're doing a fine job, Martha commented, joining Eleanor on the walking path that now wound through what had once been contaminated soil. Those black-eyed Susans will look beautiful come summer. Eleanor nodded, leaning slightly on the walking stick James had carved years ago from oak, a concession to age she had finally accepted after her second surgery 3 months earlier. The CDC investigation had discovered another parasitic cyst deeper in her neck tissue, dormant but potentially dangerous. Doctor? Bennett had removed it with his usual meticulous skill, and Eleanor's recovery had been straightforward, if slower than she would have liked. "It's hard to believe how much has changed," she said, gesturing toward the transformed landscape. The changes extended far beyond the physical remediation of the creek. Cooper Chemical's Millfield plant had been shuttered, pending a complete environmental overhaul, its operations suspended while federal investigators combed through decades of records. William Cooper himself faced multiple indictments: environmental crimes, securities fraud, obstruction of justice, his empire crumbling under the weight of scrutiny he had evaded for so long. But the most meaningful transformations had occurred within the Pinecrest community itself. Rather than destroying the town as Cooper had warned, the scandal had galvanized it. When the extent of the contamination became clear, federal emergency funds had been allocated for resident relocation during remediation. The Pinecrest Survivors Association, with Eleanor as its reluctant chairperson, had successfully advocated for the apartment complex to be completely renovated rather than demolished, preserving the affordable housing so vital to its elderly residents. "Mrs. Wilson," a young voice interrupted her reflections as Catherine's nephew, Timothy, ran up the path toward them. "We found something cool in the creek. Can you come see?" Eleanor smiled at his enthusiasm. "Lead the way, young man." Timothy guided them to a shallow section of the creek where several children were gathered around his teacher, examining something in a clear plastic container. "Look," he announced proudly. "Crayfish, Miss Johnson says they only live in clean water, so it's a good sign they're back." The small crustacean scuttled around its temporary home, pincers raised defensively. Eleanor felt a rush of emotion at this simple evidence of nature's resilience. After all the damage, all the corruption, life was returning to the creek that had once harbored such danger. "That is indeed a very good sign," she agreed, meeting the teacher's understanding smile over the children's heads. "We're documenting the ecological recovery as part of our science curriculum," Mrs. Johnson explained. "The children are keeping observation journals. Several have expressed interest in becoming environmental scientists." "A worthy ambition," Eleanor nodded. "We need more watchful eyes on our natural resources." As the class continued their exploration, Martha touched Eleanor's arm gently. "Don't forget you have that interview at 2:00. The documentary people." Eleanor sighed. "Another interview?" "As if the story hasn't been told enough times already." "People need to hear it from you," Martha insisted. "You give it a humanity those news reports never captured." The media attention had been overwhelming in the months following the CDC investigation. Local coverage had quickly expanded to national headlines as the full scope of Cooper Chemical's environmental crimes came to light. "Parasites in Paradise: Corporate Contamination in Small-Town America" had been the most sensational headline, accompanied by medical images of the extracted larvae that still made Eleanor wince. But beneath the sensationalism lay a story of genuine public importance: systematic corporate malfeasance, regulatory failure, and the courage of ordinary citizens who had refused to be silenced. The documentary team from a respected public television series had approached Eleanor with a thoughtful proposal focused on the community's response rather than merely the grotesque medical aspects. "I suppose you're right," Eleanor conceded, "though I still don't understand why people find an old woman with parasites so fascinating." "It's not the parasites, Ellie," Martha chided gently. "It's you, the retired nurse who took on a corporate giant and won. People need heroes they can recognize themselves in." Before Eleanor could protest this characterization, she spotted a familiar figure approaching along the path: Rebecca Morgan, dressed casually in slacks and a sweater rather than her usual professional attire. "I thought I might find you here," Rebecca greeted them. "The creek looks remarkable already." "Nature heals quickly when given the chance," Eleanor replied. "Unlike some human relationships." The pointed comment hung between them, an acknowledgment of the tentative rebuilding of their own connection. In the months since the investigation began, Rebecca had demonstrated a commitment to transparency that had surprised Eleanor, testifying candidly about the Creek Valley research, acknowledging the pressure she had felt to downplay corporate responsibility, making a clean break from the financial entanglements that had compromised her scientific integrity. "I deserved that," Rebecca acknowledged. "But I hope I'm proving that people can change, even after decades of compromise." Eleanor softened slightly. "You've done good work with the health monitoring program. The residents appreciate having someone who understands their concerns." The medical monitoring program had been Rebecca's initiative, a comprehensive health screening system for anyone potentially exposed to the creek contamination, funded by assets seized from Cooper Chemical. The early detection of 2 additional parasitic infections had potentially saved lives and had gone some way toward redeeming Rebecca's professional reputation. "Actually, that's why I wanted to find you," Rebecca said. "The latest laboratory analysis of the parasitic specimens shows something interesting. The dormant larvae appear to have a specific trigger for activation, a combination of chemical compounds unique to Cooper's proprietary manufacturing process." Eleanor absorbed this information, its significance immediately clear. So it wasn't just environmental contamination activating random parasites. The chemicals were specifically interacting with this particular species. Rebecca nodded. "Which supports your theory that the Creek Valley outbreak and the Pinecrest cases share a common source. The parasite you contracted in Brazil 30 years ago remained dormant until exposed to the same chemical signature here in Millfield. Meaning Cooper was using the same contaminating process in both locations," Eleanor concluded, "despite knowing the health consequences." "Exactly. The CDC is reopening its investigation into several other communities near former Cooper operations based on this finding." Rebecca hesitated, then added more quietly, "You were right all along, Eleanor. I should have listened to you in Brazil." The admission, so long in coming, settled something within Eleanor that had remained unresolved despite their recent collaboration. Not quite forgiveness, but acceptance of past mistakes, of human fallibility, of the complicated truth that good people sometimes make devastating compromises. "We were both doing what we thought was right," Eleanor said finally. "With the information and courage we had at the time." Their conversation was interrupted by the arrival of Daniel Cooper, who had become a regular presence in the community during the remediation process. Despite bearing his father's name, he had earned respect through his unflinching testimony about Cooper Chemical's environmental practices and his commitment to making amends. "The EPA team wants to show you their latest water quality results," he told Eleanor. "They're quite impressed with the recovery timeline." "I imagine your father is less impressed with the criminal indictment timeline," Martha commented dryly. Daniel's expression tightened slightly. "He's declining to comment on the advice of his attorneys, which is probably the wisest thing he's done in years." William Cooper's fall had been swift and spectacular once the federal investigation gained momentum. The environmental crimes had been just the beginning. Investigators had uncovered financial irregularities, tax evasion, and evidence of witness intimidation stretching back decades. The man who had once owned half the county now awaited trial under house arrest, his reputation and empire in ruins. "How are you holding up?" Eleanor asked Daniel, seeing beyond his composed exterior to the personal toll the past months had taken. "Better than expected," he replied with surprising candor. "There's a certain relief in having the truth finally acknowledged, even when that truth is painful." Eleanor understood completely. The physical pain of her surgeries, the emotional strain of public attention, the exhaustion of advocacy work, All had been worth enduring for the validation of what she had known to be true for 30 years. "Your daughter," she inquired gently. "How is she doing?" Daniel's face brightened genuinely. "In remission?" "The doctors are cautiously optimistic." He glanced toward the children planting flowers along the creek bank. "She wants to help with the next community planting day. Says she wants to put something good back into the world." "Wise beyond her years," Eleanor commented. "You should bring her. Children understand renewal better than most adults." As they walked together toward the EPA testing station, Eleanor reflected on the unexpected community that had formed around the crisis. Martha with her organizational skills, Catherine with her scientific knowledge, Daniel with his insider documents, Rebecca with her medical expertise. Even Diane Harlow, though not present today, had become a fixture in Eleanor's life, their professional relationship evolving into genuine friendship. The EPA team greeted Eleanor with the respect she had earned through her central role in exposing the contamination. The lead scientist, a woman in her 40s with premature silver threading through her dark hair, walked them through the latest test results with evident satisfaction. "The remediation is progressing faster than projected," she explained, displaying graphs on her tablet. "The bioremediation organisms are exceptionally effective in this ecosystem. We're seeing degradation of the target compounds at nearly twice the expected rate." "Nature knows how to heal itself," Eleanor observed, "when we give it the chance." "Exactly," the scientist agreed. "And the community engagement has been instrumental. The volunteer monitoring program you established provides data we couldn't possibly collect with our limited personnel." Eleanor accepted the praise on behalf of the Pinecrest residents who had transformed from victims to citizen scientists, meticulously documenting water clarity, wildlife sightings, and plant recovery along the creek. Many of them, like Eleanor herself, had professional backgrounds they had thought relegated to the past: retired biology teachers, engineers, medical technicians, their expertise given new purpose in retirement. After reviewing the data, Eleanor excused herself to prepare for the documentary interview. Walking slowly back toward Pinecrest, she paused at the small memorial garden that had been planted near the entrance to the apartment complex. A simple stone marker bore the names of 3 residents who had not lived to see the community's vindication, including Edith Peters, whose case had been instrumental in establishing the pattern of infections. Catherine tended the garden regularly, honoring her grandmother's memory through this living memorial. The roses were blooming now, their fragrance a poignant reminder of both loss and continuity. Eleanor's apartment had changed little despite the upheaval of the past months. James's photographs still watched from every surface, though they had been joined by newspaper clippings, community awards, and pictures of the remediation progress. The most prominent new addition was a framed letter from the governor, commending Eleanor for her extraordinary civic courage in the face of corporate negligence. Martha arrived precisely at 1:30 to help Eleanor prepare for the interview. Their friendship had deepened through the crisis, evolving from neighborly affection to something akin to sisterhood. "The blue blouse," Martha decided, surveying Eleanor's options. "It brings out your eyes and looks distinguished on camera." "Distinguished," Eleanor chuckled. "A polite word for old but presentable." "Speak for yourself," Martha retorted. "I'm considering dating again. Mr. Simmons has asked me to the senior center dance 3 times now." "Martha Cunningham, you've been holding out on me." Eleanor's delight was genuine. Life continuing, love rekindling, these were the true victories amid the legal battles and environmental remediation. The documentary crew arrived promptly at 2, setting up their equipment with professional efficiency in Eleanor's small living room. The interviewer, a thoughtful woman in her 50s, took time to establish rapport before the cameras rolled, discussing her approach and the themes she hoped to explore. "We're particularly interested in the community response," she explained. "How ordinary citizens became environmental advocates and healthcare activists when institutions failed them. "There's nothing ordinary about the people at Pinecrest," Eleanor corrected gently. "They've lived extraordinary lives, fought in wars, raised families, built careers, overcome hardships. What might look like just a collection of aging retirees is actually a repository of tremendous resilience and experience." The interviewer smiled appreciatively. "That's exactly the perspective we hope to capture." Once the cameras were rolling, Eleanor found herself speaking with unexpected ease about the journey from that first terrifying moment of discovery, the movement beneath her skin, to the community victory they were now celebrating. She described the medical odyssey factually but emotionally, the horror of her condition balanced against her professional understanding of parasitic infections. "The most frightening aspect wasn't the physical symptoms," she explained. "It was the realization that something I had encountered decades earlier had remained within me, waiting for the right conditions to emerge. It felt like the past reaching forward through time to reclaim me." The interviewer nodded thoughtfully. "And in a way, that's exactly what happened, not just medically, but in terms of the corporate negligence you had witnessed in Brazil resurfacing here in Millfield." "History repeats itself when we fail to address root causes," Eleanor agreed, "whether those are environmental toxins or corporate cultures that prioritize profit over human life." The conversation shifted to the community organizing that had followed, the evidence gathering, the legal challenges, the medical advocacy. Eleanor was careful to highlight the contributions of others, diminishing her own role in favor of emphasizing the collective response. "You've been called a whistleblower, an activist, even a hero," the interviewer noted. "How do you see your role in what happened?" Eleanor considered the question seriously. "I was simply a witness who refused to be silenced, first as a nurse in Brazil, then as a patient here in Millfield. The parasites made it impossible to ignore what was happening, literally brought the environmental contamination to the surface where it couldn't be denied." As the interview concluded, the interviewer asked one final question. "What would you like people to take away from your experience?" Eleanor touched the scar on her neck, now faded but still visible, a permanent reminder of what had been growing beneath her skin and the larger corruption it had revealed. "I want people to understand that age doesn't diminish our right to dignity, to safety, to clean air and water. That retirement communities aren't waiting rooms for death, but vibrant collections of human beings with wisdom, experience, and determination." She smiled slightly. "And I want corporate executives to know that they should never underestimate a 60-year-old woman with medical training and nothing left to lose." After the crew packed up and departed, Eleanor found herself alone in the quiet apartment, pleasantly exhausted by the day's activities. The late afternoon sun slanted through her windows, illuminating James's photographs with a golden glow that always made her feel his presence more acutely. "We did it, James," she said softly to his image. "We stood our ground." A gentle knock at her door revealed Catherine holding a small potted plant. "From the children," she explained, presenting the gift. "They wanted to thank you for talking to their class last week about the creek restoration." Eleanor accepted the plant, a small native fern in a decorated pot, touched by the gesture. "Please thank them for me. It's going straight to my windowsill." Catherine hesitated in the doorway. "There's something else you should know. The test results came back on my tissue samples." Following her grandmother's death, Catherine had requested testing for potential parasitic exposure given their shared environment. Eleanor felt a surge of concern. "And?" "Negative," Catherine assured her quickly. "But they found antibodies suggesting prior exposure. The doctor thinks I may have been infected at some point, but fought it off before larvae could develop." "Your immune system is younger, stronger," Eleanor nodded. "Mine was compromised by age and the specific exposure history from Brazil." "That's what Dr. Morgan said," Catherine confirmed. She's recommended ongoing monitoring for everyone under 50 who lived near the creek, just to be safe. The news was both concerning and reassuring, evidence that the contamination had indeed affected more people than initially documented, but also that many had naturally resisted the worst effects. The community's health monitoring program would now have additional data to guide its approach. After Catherine left, Eleanor placed the gifted fern on her windowsill where it would receive gentle morning light. Life continuing, adapting, finding a way forward even after trauma, the biological imperative that had served Earth's creatures for millennia. That evening, as had become their custom, the core group of what the local paper had dubbed the Pinecrest Defenders gathered in Eleanor's apartment for dinner. Martha brought her famous chicken casserole, Rebecca contributed a salad harvested from the community garden that had replaced her sterile lawn, and Daniel arrived with sparkling cider and dessert from the local bakery. Their conversation flowed easily now, the initial tensions and suspicions dissolved through months of shared purpose. They discussed the upcoming town council meeting where the final phase of the remediation plan would be presented, Catherine's proposal for a permanent environmental monitoring program, and the latest development in William Cooper's legal proceedings. His lawyers have approached the prosecutor about a plea deal, Daniel reported, his expression complex. They're offering full financial restitution in exchange for reduced charges. After everything he's done? Martha's indignation was immediate. The man belongs in prison. The prosecutor is consulting with affected residents before responding, Daniel explained. They want to know if the community would prefer guaranteed compensation over the uncertainty of a trial. Eleanor considered the question thoughtfully. What would the money be used for? Environmental remediation, medical monitoring, community development, Daniel listed. Essentially, rebuilding what his company damaged, both environmentally and socially. And your father would avoid prison? Daniel nodded. Likely house arrest, forfeiture of assets, permanent barring from corporate leadership. Eleanor looked around the table at the faces that had become her closest allies and friends through the crucible of the past months. What does justice look like in this situation? Punishment or restoration? The question hung in the air, complex and without easy answers. Martha still favored punitive justice, while Rebecca leaned toward pragmatic acceptance of guaranteed compensation. Catherine and Daniel seemed torn, seeing merits in both approaches. Perhaps we should bring this to the wider community, Eleanor suggested finally. The decision affects everyone at Pinecrest, not just those of us in this room. The suggestion was unanimously approved. A community forum would be organized, all perspectives heard, a collective decision reached. It was how they had operated throughout the crisis, Eleanor's natural leadership guiding but never dictating their approach. As the evening wound down and her friends prepared to leave, Eleanor felt a deep contentment that transcended the physical discomfort of her healing body and the emotional strain of the past months. This unlikely family they had formed, bound not by blood but by shared purpose, had given her final years a meaning she could never have anticipated. "You know," Martha said as she gathered her casserole dish, "the anniversary of your diagnosis is coming up next month. We should mark the occasion somehow." "A celebration of a parasitic infection?" Eleanor raised an eyebrow. "That seems macabre even for us." "Not the infection," Rebecca clarified. "The beginning of something important, a community finding its voice, a wrong being righted after 30 years. Daniel nodded thoughtfully. "A commemoration of truth finally emerging." "Like the parasite itself," Eleanor mused, touching her scar, working its way to the surface where it could no longer be ignored. After they had gone, Eleanor stood at her window overlooking the transformed creek, the memorial garden, the community that had weathered crisis and emerged stronger. The physical parasite had been removed from her body, but its legacy remained, in the strengthened environmental protections, the ongoing health monitoring, the corporate accountability, and most importantly, in the connections forged through shared struggle. The night was clear, stars visible despite the modest light pollution of Millfield. Eleanor thought of James, of the life they had shared, of the values he had instilled in their daughter Catherine, values of integrity and perseverance that had guided Eleanor through this unexpected final chapter of her life. "One last mission accomplished," she whispered to his memory, her reflection in the window overlaying the stars beyond, an aging woman with a scar on her neck and peace in her heart who had refused to be silenced when truth needed to be spoken. Outside her window, the creek flowed clean and clear beneath the moonlight, nature's resilience a testament to the possibility of healing, of restoration, of new life emerging from even the most toxic circumstances. When Eleanor Wilson discovered that terrifying movement beneath her skin at age 60, she never imagined it would lead to her greatest act of courage. Her story reminds us that our golden years aren't meant for silent suffering or resignation, they're for standing firmly in our hard-earned wisdom. Eleanor fought not just for herself, but for her entire community when everyone expected her to quietly accept injustice. She transformed her pain into purpose, her medical knowledge into power, and her age into an asset rather than a liability. Like Eleanor, we carry within us decades of experience that younger generations desperately need. Our voices matter, our persistence matters, our refusal to be dismissed matters. The scar on Eleanor's neck became her badge of courage, a reminder that healing is possible even after the deepest wounds. What battle have you been hesitant to fight because you felt too old or too alone? What wisdom from your life experience could benefit your community if you found the courage to speak up? Remember Eleanor's words. Age doesn't diminish our right to dignity. Share your own story of standing up for what's right when others wouldn't in the comments below. Your journey might be exactly what someone else needs to hear today.